The patella is the largest sesamoid bone in the body. What is a sesamoid bone? A sesamoid bone is a bone that essentially does not articulate with any other bone in the classical sense, but instead floats, so to speak, within a tendon and moves with that tendon. The patella is embedded within the quadriceps tendon. There are four muscles that make up the quadriceps muscle group: the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. Together, the four muscles converge towards the patella and envelop the patella within the tendon that these four muscles created. This tendinous tissue then continues onward to finally insert on the tibial tuberosity. This portion of tissue between the patella and tibial tuberosity is technically a ligament since it starts from bone and terminates on bone. So you may see this structure referred to as the patellar ligament. This is in contrast to the quadriceps tendon, which arises from muscle and terminates on bone. Now you may ask yourself, why did nature place this random bone in this location? What purpose does it serve? Have you ever tried to close a door from here? Probably not. Most likely, the last time you closed a door, it was from here. So why did you choose to close the door furthest from the door hinge? Because the doorknob is placed there? No. The doorknob was placed there because the laws of physics show us that this is the place from which the least amount of effort is needed to close that door. So now we're moving into the concept of torque, and torque can be defined as the tendency of a force to produce rotation. Now that may or may not make sense, so let's discuss it a bit further. Here we have the mathematical formula for torque. So torque, which is this fancy T right here, equals force times distance. Now, which distance are we talking about? We're talking about the distance from the axis of rotation to where the force is being applied. So if we look at this diagram over here of the door, for example, this black circle over here is the door hinge, which is the axis of rotation, right? This door is essentially swinging and rotating around this axis right here, okay? This is stationary. This is the doorknob all the way on this side, okay? So now the distance is going to be the force of application from the axis. So let's say in the first example, when we were pushing the door closed very close to the door hinge, let's say that distance was 3 inches, okay? 3 inches. And I'm applying the force right at this point over here after 3 inches, okay? So I'm just gonna draw an arrow like this, a force vector. This is a force vector like this, okay? The distance will be a perpendicular line, or I should say a line that is perpendicular to the force vector and runs to where the axis is, okay? So over here in this example, the distance D would be 3 inches, okay? So let's work that out mathematically and see what that tells us, okay? So let's say, for example, I want to solve for this torque, okay? I applied my force at 3 inches from the axis of rotation, right? And let's say I applied a force of 5 pounds, okay? 5 pounds worth of force, all right? So this would be 5 pounds over here. 5 times 3 equals 15 pound-inches of torque, okay? That would be the units we're dealing with, pound-inches, okay? 15 pound-inches of torque. Now, let's say the opposite situation where we're deciding to now push the door closed further away from the door hinge, all right? Closer to the doorknob. Let's say we do it at this distance over here. Let's say this is 30 inches, okay? 30 inches. And now I'm applying the force over here, okay? But I'm applying the same exact amount of force, okay? I'm not going to change how much force I'm applying. I'm still applying 5 pounds of force, but now my distance is 30 inches. So what does that mean? That means 5 pounds of force times 30 inches is going to give me how much? 150. 150 pound-inches of torque are produced simply from me changing my position, from getting further away from the axis, okay? This is how levers work, all right? This is the concept of torque, all right? And this is why it works that way. So what does all of this have to do with the patella? Well, when you think about it, all the movements of your musculoskeletal system are essentially rotatory movements of limbs around joints. So if we look at the knee, we notice that the leg is like the door and the knee is the door hinge, and it'll act like this, okay? The force is being produced inside of the quadriceps muscles, but the site of application is where the quads attach to the tibia, which is right the tibial tuberosity, like so. The patella effectively deviates the force vector that the quads is applying to the tibia, so that the force vector is going to look like this. Notice it's going along with this attachment site for the quads. Imagine if there's a situation with no patella. If there was a situation with no patella, then our force vector would look like this, okay? Now see that in both situations, right, the force vector is going up and towards the right, but when the patella is here, it deviates it further towards the right, which does what? It deviates that force vector farther away from this axis of rotation of the knee joint, which is this blue dot right here. You can see that over here, when there's no patella, that distance is smaller, which means that the torque produced here is going to be much smaller than the torque produced in this situation, which means the force can produce the same amount of torque with less force. So now that we know why it exists, let's discuss exactly what it is that is existing. The anatomy. This is an anterior view from a right-sided patella. We can orient ourselves with the coordinate diagram in the upper left-hand corner. From this view, the most relevant features are the base on the superior end and the pointed apex on the inferior end. If we flip the patella at the base, we can now see the posterior aspect of the patella with the apex pointing upward. The first thing we can note on this surface is the variation of contours. Note the vertical ridge in the middle, which separates the lateral facet from the medial facet. Notice that the lateral facet is much larger than the medial. We'll see the significance of this in a short while. There is also a third facet off the medial side known as the odd facet. These are the surfaces that directly interact with the femur. This is an inferior view of the femur. Looking at the femoral condyles, pay attention to the anterior side where the patella rests. That lateral surface is much larger than the medial. So here you can see how the surfaces of the patella fit onto the condylar surface of the femur like a puzzle piece. The question is, why is it constructed in that particular way? If we look at the femur and tibia articulated together, we note that they create an angle on the lateral side. This is normal and is known as a physiologic Genu valgum. However, the result of this is that with the quads pulling the patella along this direction, there is also a component force to this that is pulling the patella laterally. This is why nature formed a buttress against that force with a more pronounced lateral facet and lateral condyle to resist that laterally directed force. Even still, those systems can fail and the patella can become dislocated anyway. And you can see that lateral dislocations are the most common type of dislocation to get in a patella, and you understand why. Risk factors that can predispose you to getting a patellar dislocation include having an increased Genu valgum, having weak vastus medialis muscles, or having a very tight IT band. Congratulations, you made it to the end of the video. Now you have a better understanding of what the patella is, why the patella is, how the patellofemoral joint functions, and you got an extra lesson about torque, okay? I hope you guys liked that video. If you have any kinds of questions or topics that you'd like me to cover, please comment in the section below. like, subscribe the video, and I'll see you guys next time. Peace.